everyone. Today we will learn about Norma Verticalis and Norma Occipitalis. First we shall start with Norma Verticalis. Here is the superior aspect of the skull. The superior view of the skull is known as Norma Verticalis. The outline of this appears to be ovoid in shape, which is relatively wider on the posterior aspect. Let's see the bones and sutures forming this view. So the first bone is the frontal bone, which is a forehead bone. So the squamous part of frontal bone is visible in this view. Parietal bones. Parietal bones are well appreciated behind the frontal bone, and these quadrilateral shaped bones present on each side of midline. Posterior most bone is the occipital bone. Let's see the sutures joining these bones. Coronal suture. The suture which is running across, joining the frontal bone with two parietal bones, is known as coronal suture. Lambdoid suture. Lambdoid suture, the suture connects the two parietal bones with the occipital bone, is lambdoid suture. Sagittal suture. Sagittal suture is the midline suture connecting the two parietal bones. So these are the sutures which are visible in this view. Let's see some more features. Bregma. Bregma is the meeting point of coronal suture with the sagittal suture, is known as bregma. The highest point on the sagittal suture, where a height of an individual is measured, is known as vertex. The maximum convexity of the parietal bones on the either side, the eminences are termed as parietal eminences. So each one is parietal eminence or parietal tuber. Ossification of parietal bone begins from this parietal eminence. Lambda. Lambda is the meeting point of sagittal suture with lambdoid suture. The tiny foramina which are observed on each side of the sagittal suture over the parietal bone are parietal foramen, and the most prominent parietal foramen are observed above the lambda, 3 to 3.5 centimeters above the lambda. These foramen transmits emissary veins, and the intersecting point between these two foramen over the sagittal suture is obelion. Obelion is an important landmark over the skull which indicates the formation of sagittal suture in fetal skull. The upper skull cap, the dome-like arched roof of the skull which forms the skull cap, is known as vault of the skull. Here is the fetal skull. So instead of bregma, at the site of bregma, we can see a large membranous gap which is like a diamond shaped gap. This gap is known as anterior fontanelle. Anterior fontanelle closes 18 months to 2 years after birth. The membranous gap present at the site of lambda is the posterior fontanelle, which is well appreciated in the posterior aspect of the fetal skull. Normally this gap closes 2 to 3 months after birth. The applied aspect of these membranous gaps, they allow the brain to grow in fetuses and infants, and they help for easy parturition. Means during childbirth, because of these fontanelles, the bones of the skull overlap over each other, allowing molding. Clinical significance of anterior fontanelle. We know anterior fontanelle is the largest among all and it closes last. So the abnormal outward bulging of this anterior fontanelle indicates increase in intracranial pressure. which may be due to excess accumulation of CSF, cerebrospinal fluid, or due to various reasons. Abnormal depression indicates dehydration. Ultrasonography of brain in infants is performed through anterior fontanelle because their fontanelle is soft spot on the skull, which provides an acoustic window for the radiologist to do ultrasonography. Let's see the internal features of the cranial vault. The internal side of the cranial vault is also termed as calvaria. The cranial vault on the internal side have same bones like Norma verticalis. Anteriorly frontal, posteriorly occipital, on each side parietal bones. Let's see some differentiating features. Frontal crust. Frontal crust is the midline crust seen on the inner aspect of the squamous part of frontal bone. Falx cerebri attaches to this crust. Falx cerebri is the fold of dura mater which attaches anteriorly to frontal crust. Sagittal sulcus. We all know sagittal suture, which is present in the midline joining the two parietal bones. Along the sagittal suture, there is a shallow groove which is termed as sagittal sulcus. The lips of the sagittal sulcus gives attachment to falx cerebri. Within this fold of dura mater, that is within the falx cerebri, there is a dural venous sinus. Dural venous sinus means a blood-filled gap present between the two layers of dura mater is dural venous sinus. So the dural venous sinus which is lodged in the sagittal sulcus is superior sagittal sinus. The inner surface of the frontal and parietal bones along the sagittal suture is uneven, exhibiting some pits or irregular depressions. These pits lodges arachnoid granulations which are concerned with the draining of CSF from subarachnoid space into nearby dural venous sinus, which is known as sagittal sinus. Let's continue with Norma Occipitalis. When skull is seen from exterior, the posterior aspect of the skull is known as Norma Occipitalis. First, we shall identify the bones contributing the formation of Norma Occipitalis, the two parietal bones superiorly, mastoid part of temporal bones which are paired on the lateral aspect, squamous part of occipital bone is present in between. The occipital bone is divided into two parts. Upper squamous part of occipital develops from membranous ossification and lower basilar part develops from cartilaginous ossification. Later these bones fuse completely to form single occipital bone. In few individuals, they may not fuse to form a single occipital bone. Instead, the squamous part may remain as a separate bone called interparietal bone. Physiologically, it won't make any difference, but is important to know to differentiate it from fractures. Sutures appreciated in this view are posterior part of sagittal suture and lambdoid suture. Along the sagittal suture and lambdoid suture, sometimes we may appreciate a small individual bones which are irregular and star-like bones. These bones are known as supernumerary bones. They get ossified from their own ossification center, and these bones just add number to the individual. It doesn't make any physiological difference. And laterally, we can see two more sutures where the occipital bone meets with the mastoid part of temporal is known as occipito-mastoid suture. Similarly, the mastoid part meets with the parietal bone to form parieto-mastoid suture. The point where these two sutures meet is known as asterion. Let's see what the prominent features of this view. External occipital protuberance is a midline projection of the occipital bone which forms the inferior aspect of the Norma Occipitalis. The tip of the external occipital protuberance is considered as a landmark of skull known as inion. And on the each side of external occipital protuberance, there are arching lines which are termed as superior nuchal lines. Superior nuchal lines and the external occipital protuberance demarcates the head from the neck region. In few individuals, above to the superior nuchal line, we may find faint arching ridges which are termed as highest nuchal lines. Highest nuchal lines are present a centimeter above the superior nuchal lines, which are not seen in all skulls. In very few we may find. And mastoid bone is identified by a small tiny foramen which is called as mastoid foramen and present over the mastoid process near occipitomastoid suture. Emissary vein and meningeal branch of occipital artery passes through mastoid foramen. So this is all about Norma verticalis and Norma occipitalis.